And there's also different sizes of handles as well. So we've got the Coupland's one there, and we've got another elevator here with a rather bigger handle, so that's this one. And we've got a very narrow tip of blade, and then we've got quite a broad blade tip there. So here you can see there's a great big difference between the tip diameter and the handle diameter, far more so than here, which are more similar. What that means is that if we're going to use rotation, we have a massive mechanical advantage with our large handled instrument. Large handle, narrow tip, then we get this massive advantage. That's fine, it helps, it saves your effort, but beware that if you do it too hard, too quickly, then an awful lot of force is fired down that instrument, and that can damage both the tip of the instrument, but also quite readily will break roots. So how do we use them? So we've got our luxation, our blade sneaking down into periodontal ligament space and cutting the periodontal ligament fibers. And then we can start to use different types of elevation. And in all of these examples, really what we're trying to achieve is the same. We're trying to break down the periodontal ligament fibers, and we're trying to very slightly expand the size of the socket, the alveolus. And those two things should enable us to remove our tooth root. So elevation, we can use wedging. So in the same way that we use the luxator advancing towards the apex of the tooth, we can do that with the elevator, but that chunkiness of the metal means that we get more of a wedging effect. And as we push and apply a small amount of controlled force, pushing that blade towards the apex, then it starts to squeeze the tooth in one direction. So if we look at our first diagram here, working here, we're starting to squeeze it in the opposite direction by having just that thickness of metal headed down towards the apex. It's squeezing it to this opposite side. Okay, and then we can start to loosen there and then go to the opposite side and do the same. So wedging is just this apical pressure on the elevator, and it starts to open up a gap on the same side as itself and crush fibers on the opposite, which can damage them too, and that's fine because we're trying to break them down. We could also use rotation, wherein we do the same thing, and then once our instrument is part way down the socket, about the sort of level that I've showed there, so maybe well, certainly I would say no less than 25% the root's length, but here we're on about a third or more. Once we're in a suitable position, we can then with an elevator apply a little bit of vertical rotation, and then we hold the tension, and then we count. And with all of these techniques, I would count personally to 20. We often say 10, but I've found that actually waiting to 20 will often give you that extra time that allows the periodontal ligaments to fatigue and give and start to loosen our tooth. So we do that in a vertical direction. We could also do it in horizontal. So here we've got a double rooted tooth that I've sectioned in half, and my elevator is between the roots and this aspect. So we aim our concave portion of elevator towards the portion of root we want to extract first, and then we're going to, you can see that it's a nice tight fit, and then we're going to gradually rotate it so that this corner comes down in this direction. Okay, so rotate down to there so that it's gone from that position to that, and it's squeezing them apart. And you can see that there's no gap here, and then we see that once we've gradually and slowly does it, you don't suddenly go from there to there. You do an incremental sort of a couple of degrees, a couple more degrees, each time probably counting to 10 or 20, till eventually you get to this point and it's opening up a gap here and here. And again, at this point you can give it the 20 seconds. So we've got horizontal rotation as well as vertical.